Doctors of Reddit, what are some unknown facts about the human body? Story 1, I didn't see this one mentioned. We don't really know how our bodies tell the difference between gas and poop. We have some hypotheses, and we know that there are a lot of nerve endings in the area, but we don't fully know how our bodies tell our brains this is a fart, let it go. It's so different that we even pass gas while we sleep, which is crazy to me. That difference must be quite deep. Story 2, a pathologist told me that the most exciting part of his job wasn't figuring out how someone died. It was seeing all the horrific things that can happen to someone and still be alive. He maintained taking over-the-counter drugs for the symptoms, even though he was too busy at work to take time off. The coroner had to become involved because he died alone. They did an autopsy. He had cancer in 3 places on his body, but he never quit. That guy was tough like they used to be. Story 3, I help people sleep better. We have some decent ideas about how REM affects the brain and health, but we still don't know what the point of dreaming is. Why do we even dream? And why do dreams have a story instead of random pictures that don't make sense? Sadly, this probably won't even be fixed. I suppose it might just be that we have consciousness. When our consciousness doesn't have any senses to work with and is cut off from our bodies, it doesn't just stop running, it has to make up stories. It might not have any purpose at all, it could just be something our minds come up with when they can't be active. Or, for a crazier idea, we are witnessing other worlds. Wow, that's a really compelling reflection. You're blending science, philosophy, and a bit of poetic mystery. I think a lot of people would resonate with that. The idea that dreams are just consciousness spinning its wheels in the absence of sensory input feels surprisingly grounded. Like when the body's on standby, the brain doesn't just power down, it improvises, makes stories, fills the silence. That totally fits with how dreams feel, sometimes profound, sometimes absurd, but always something. Story 4, in human cells and most other eukaryotic organisms, there are organelles called vaults. The major vault protein is made up of 78 copies, which is nearly 3 times the size of a ribosome and bigger than most viruses. We don't fully understand what they accomplish, but it's likely related to the nucleus. There are even gene analogs for vaults in bacteria. Life on Earth must have started creating vaults early on because they are present in so many different types of organisms. The fact that different species have comparable genes that code for vault proteins suggests that vaults are important for life. Yet investigations have not demonstrated that lab animals that had their vault genes knocked out suffered a lot of harm. Even odd, some of the species utilized in labs as model organisms don't have vaults at all. People have been using these species for a long time, even before vaults were found in 1986. Some of them have been used for more than 100 years. Story 5. It seems that we don't know much about fibroids, which 75% of women have at some point in their life. That's wonderful news since the biggest one taken out weighed 100 pounds, which is not a small problem. There are hypotheses regarding certain hormones and what things make you more likely to have them, but other than undergoing surgery to remove your current ones, there isn't much knowledge on how to keep them from coming back. She has one, and the doctors informed her she might have cancer because her fibroid was growing so quickly. I did a lot of research and found that fibroids can cause cancer, but the chances of that happening are only 1 in 10,000, and almost all of those cases are in women who are going through menopause. Also, her fibroid's growth rate wouldn't have met the old definition of rapid growth rate. The statement wasn't completely incorrect, but it was kind of true in the sense that anyone could develop cancer. But it undoubtedly made people more worried than they needed to be. Story 6, I'm a doctor. Here are a handful that come to mind right away that are actually quite big. We still don't know exactly how anesthetic works. We only know that it has certain effects, and since those effects are helpful, we use it. We still don't know much about how the brain works when it comes to mental illness. It's always changing, we don't know much about the medicines we use now, and the rules for diagnosing diseases are continually changing as we figure out that, hey, maybe all these behaviors aren't the same source disorder. It's quite challenging to make a diagnosis when most of the criteria are reliant on self-reporting and subjective observations. Neurology is still learning a lot, but not as much as Hash 2. It's more advanced since you can see more objective results in neuro than in psych. But we still have a lot of trouble understanding how brains work. Story 7. Food allergies in particular. And why do adults get them after never having them before? Having a new allergy is very annoying because it can take a while to figure it out. You don't even think about it because it was safe to eat before. When I was a youngster, I always enjoyed pistachios because they were a gift from my mom on Christmas. She would put nuts and fruits on the table runner every year. I would even suck on the salty shells and then spit them out in a mound. Then, as an adult visiting for Christmas dinner, my throat started to close up not long after I ate one. It scared me a lot, but Benadryl helped after a few minutes. My sister brought hibiscus tea and lemonade to dinner, which was the only new item I had eaten. She was trying out healthy recipes, so I thought for sure it was that. I poured out my drink and only drank water. I had to do it all over again a few minutes later when I had another pistachio. Just so you know, I found out that my stepmom's green jello salad was really a pistachio jello after I ate it and had a bad reaction. It took me a bit to figure that out too, because why would there be nuts in a salad? I believed it was a fruit instead. Story 8. I'm a surgeon scientist who is still training, but I'm almost done. I'm going to focus on trauma surgery and critical care, so that's where most of my interest lies. I'm now exploring how to figure out who lives and who dies following a significant trauma. In other words, why do some patients recover and others don't? Even when they have the same injury pattern, severity of injury, age, comorbidities, etc. We don't know a lot about ICU medicine, which is the same line of thought. Once you're in the ICU, such as with trauma or sepsis, we mostly give you supportive care and don't do much else because we don't know enough about the diseases to take steps to stop them or treat them. So, trauma patients in the ICU are far more likely to have an infection, typically ventilator associated pneumonia, but we don't know why or who will get it. We also don't treat them ahead of time. We just wait for it to happen. We don't even know the most basic ways the body reacts to trauma, like why severe trauma causes a big or systemic response, and less severe trauma causes a more localized response. We also don't know which pathways can be targeted to help with recovery. Story 9. Infertility with no known cause is the name of a real diagnostic that my wife and I got. Based on what modern medical science understands about fertility, all of our tests show that we're fine. We should be able to get pregnant. All the numbers are right. We might even be able to get pregnant with other partners. But no one knows why we can't be together. And it happens to a lot more couples than people talk about. But the only diagnosis we all get is infertility that can't be explained. That's incredibly heavy. I can't pretend to know exactly how that feels, but just reading your words, the weight of them lands. Infertility with no known cause. There's something brutal about the coldness of that phrase, like it acknowledges the problem but offers nothing in return. No path forward, no closure, not even something to fight. Just a blank wall where you expected an answer. And it's so hard when everything looks like it should work, when you're told you're both fine, but somehow it still doesn't happen. Story 10. Not a doctor, but a patient who has identified a few things that clearly don't have answers. You can't tell what you're allergic to with allergy tests. You can find out what your skin is allergic to with a prick test and what your blood is allergic to with a blood test. But there is no test that can tell you what your stomach or GI tract is allergic to. You can perform an elimination diet for a long time to get some answers, but even then, it's not always clear if a certain item or group of foods causes inflammation or allergic reactions that aren't life-threatening. Costochondritis is a disease that makes the rib joints lock up. It feels like a heart attack when they come loose, which is also fun with GERD, which causes comparable feelings. People don't know why they get it or how they get it. It could be too much work. Maybe it's not enough work. It could be because you're pregnant, overweight, or walking too much. Or maybe you're just not lucky. Most doctors don't know about it, shrug it off as nothing, and say, Take a couple of advices and you'll be fine. Even though medical data show that most people have it for a year or more, I'm going on 5 years with it. I am not okay at all. Every doctor thinks I'm nuts. I spent the weekend in bed since I was having a flare and it hurt so much. But my heart, lungs, and GI are all fine, so I assume I'm out of luck. Story 11. At a basic level, there are a lot of questions that haven't been answered yet. This is true for a lot of the typical ailments we see and treat. We usually know a lot about the hazards and exposures that go along with them. We usually know some but not all of the genetics. We know how to help a lot of them. We don't know what makes type 1 diabetes happen. We don't know what makes asthma happen. Many other disorders and exposures are linked to it, but the actual cause is hard to find. We don't know for sure what makes some premature babies get very bad BPD and others not. We have a good notion of some of the things that happen, but we don't know exactly what causes them. We are also getting a lot better at taking care of these babies. Story 12. My husband has seen a lot of doctors for different health problems, and my mom is an RN. I promise you that most doctors don't know what's going on and look things up when they're not in the room. The first time I was positive that a provider comprehended exactly what was going on was when a neurosurgeon looked at my husband in 2023. We knew that he had stenosis of the cervical spine, which meant that the vertebral column in his neck was getting smaller and would eventually pressure his spinal cord until he couldn't move. When you get your healthcare via the VA, surgery for that is one of those things that you should only do when you really need to. In January 2023, my husband started having drop foot, which means that one leg won't pick up correctly. He also couldn't move his right arm much past his hip. He fell a couple times, but luckily he fell on the couch both times. His fingers were numb. I informed him I was taking him to the hospital around 4 a.m. I was still dressed for a night out, and the nurse in the ER thought we were drug seekers and told us we were wasting our time. I was really annoyed with how she was acting, so I responded, "Did you miss the part of his explanation where a neurologist told him he needs to go to the emergency room if he has these symptoms? We don't want your medicine, we just want him to be able to move again." Story 13. I used to work as a PA for more than 40 years in both clinical and academic settings. The more we study, the more we realize there is still so much to learn. There is a true placebo effect. It works, but we're not sure how. It works for more than simply pain relief. We utilize a lot of medicines that function well, but we don't know exactly how they do it. The pharmacology is not clear. There are still a lot of things we don't know about how our brains work, even though newer technology has helped us understand them better. Whenever I try to study more about something, and OB or GYN was never one of those things, I wind up with more questions than answers. It's what I love about medicine. That's such a grounded, honest take. And honestly, kind of beautiful. There's a humility in what you're saying that feels rare, especially coming from someone with decades of experience in medicine. So many people think of science and medicine especially as this place of certainty. But you're pointing out something more real, that the deeper you go, the more mysterious it gets. That's not failure, that's the nature of it. Story 14. I tell the people who live with me that only approximately 40% of what we do is based on evidence. A lot of what we do is based on weak evidence or not enough follow-up. For example, the longest semaglutide trials last about 2 years. They make it sound longer by saying that Sustain 6 and Step 5 last 104 weeks. What are you going to do to check on these drugs' safety after 5, 10, or more years? There is a good tendency toward looking at established treatments again, and a lot of them have been changed by medical reversals. See the book of the same name. For example, think of 3V coronary disease and estrogens after menopause. This is a roundabout way of expressing that we don't really know what we think we know about the body. If you want to worry about how weak we are, think about the basilar artery. This one site of failure in your brainstem is only 3 millimeters wide and lets blood flow at a rate of 150 millimeters per minute. 3 millimeters is a little more than 1/10 of an inch. Story 15. One of the annoying but not really secret facts about medicine is that there are ethnic differences, but they can't be talked about right now. There are disparities in how well medicines work, how they grow, how likely they are to get sick, and how immune they are to disease. It's stopping treatments that are tailored to each person. AI can now make quite good guesses about someone's race based on just one chest x-ray, so things could change. People always think of this as a bad thing, but it should be thought of as family history being very important for keeping an eye on cancer or heart disease. You aren't completely wrong, but disparities in how well medicines work, how likely people are to get sick, and other things like that are, or should be, caused by genetics or other risk factors, not by skin color or a social definition of race. Many research have shown that race-based medicine is not useful, and that including or excluding race in medicine is not helpful either. For a long time, race was a good stand-in. It's time to move on from that. Story 16, I found this topic and wanted to share something fascinating about myself, to see if any doctors or nurses here might want to learn more about it. I have been able to turn my sympathetic nervous system, ASNS, on and off at will since I was a youngster, without needing to meditate, do breathing exercises, or be around other people. Some of the physiological responses I can cause are heart rate modulation. A nurse at my job recently measured my heart rate going from 68 BPM to 135 BPM in 10 seconds after I turned it on and back to 90 BPM in 10 seconds after I turned it off. After about 60 seconds, it went back to normal. I can regulate my pupils nearly like a camera aperture, making them bigger or smaller in real time. Body temperature control. I have seen the temperature go up by around 1 degree Fahrenheit in 30 seconds after turning it on. Autonomic responses. When I activate the reaction, I can cause piloerection, goosebumps, marbling of the skin on my hands, fine hand tremors, and changes in my breathing patterns. All of these things go back to normal as soon as I cease triggering the response. Story 17. As someone with endometriosis, I don't understand why OBGYNs still aren't being taught about prevalent health problems like this one. This is especially true because endometriosis affects 10 to 20% of all women, is one of the 10 most painful disorders in the world, and is a major cause of infertility and ovarian cancer. We don't know what causes endometriosis, but we do know that it spreads like cancer. It has been detected in the lungs, hearts, brains, legs, sinuses, and eyeballs. We don't know why. We still don't know how to stop endometriosis from coming back. There is no way to become better. These are not cures for most women. They are not hysterectomies, pregnancies, birth control, or surgery. They are only ways to manage symptoms. We don't know how to treat complex types of endometriosis, including thoracic endometriosis, which can be deadly since it can cause pneumothorax or lung collapse from endolesions, or pericardial endometriosis, endo on the tissue around the heart. Women with the less common kinds of endo have to have surgery after surgery and hormone after hormone, with no respite or chance of getting better. Story 18, another not a doctor but answer. I have a condition that isn't common. I've seen a lot of different doctors and specialists. Every 7 to 10 years, my body attacks itself. What? Yes. Every 7 to 10 years, I have an allergic reaction that makes my body go crazy. I have hives all over my body. The medicine doesn't work to get rid of the hives. Depending on how terrible the episode is, I have to go to the hospital for a week or two every time it happens. They take every allergy medicine when it happens, but none of them work. They gave me adrenaline, and it worked for a minute or two, and then it didn't. The hives come back. Every time this happens, I have to stay in a hospital with an IV for a week or two. I had tests done to find out what I'm allergic to, and the answer is nothing. The last doctor I saw said that something is happening on a subatomic level, but we don't know what it is. Story 19. One subject that remains fascinatingly underexamined is what I refer to as neuroquantum resonance. Although not acknowledged in mainstream academia, nascent anecdotal evidence from discrete clinical observations indicates that microtubules within neurons may function as diminutive quantum processors. In theory, these structures could enable immediate alterations in cerebral firing patterns through quantum-level vibrations, thus tuning our brain circuits in real time. For example, there have been accounts of patients having brief episodes of hyperclarity or remarkable pain relief when they are under a lot of stress or when particular environmental conditions are present. The premise of NQR posits that quantum fluctuations temporarily reconfigure synaptic connections, enabling the brain to circumvent conventional processing pathways. This might help explain things like quick flashes of understanding or, on the other hand, short periods of dulling of the senses. Even though these theories are still only ideas and it's hard to examine them, since it's hard to separate quantum effects from biological tissue, the idea of neuroquantum resonance is an interesting new area of research. If validated, it could fundamentally transform our comprehension of consciousness and facilitate the development of novel therapeutic approaches aimed at these quantum channels. Story 20, a number of things in terms of clinical setting. For example, you may ask, what's the best medicine to treat problem? And get a lot of different answers because you're just thinking about the problem in general and presumably looking at data from thousands of people that have been researched. But which one is the best? Safest? Most effective? Whatever effective means. For that one patient you're treating who has other medical issues that make them too sick to have ever signed up for the studies you mentioned while making the decision. That's where you can see that medicine relies a lot on clinical judgment. It's okay to ask, what's the best drug to treat problem? But in the clinical practice, the question is more like, what's the best medicine to treat problem in a patient who also has three other medical issues, already takes other med, has particular physical exam finding and/or lab values, and is allergic to treatment option? Story 21. There have been so many incredible, unbelievable improvements in medicine that are almost like miracles. Why do people still only fix their vision by putting plastic or metal things on their faces? Or on the cornea itself? Why isn't there medication or an easy operation that doesn't cost $10,000? The problem is, laser surgery doesn't really cost that much money. It's just the franchise and profit charges. The real cost is the time it takes for the person to execute the process, which is less than an hour. And by the way, lenses don't have to cost a lot of money, even if they are progressive or hard to get. Machines make all of the lenses now. Once more, such costs are just profit and maybe franchise fees. There are no real physical costs. I get my lenses done for less than $100, and they are a hard, progressive prescription. I buy them online, but in a real store, I have to pay around $350 for each lens. Sorry, I just needed to rant. I won't even get into the whole dental implant scam. Wow, that's another one. Story 22, I still hope that someone will come out with a new spine that can replace the one we have now for people with bad spines. I told all the doctors I've met in my job delivering emergency medical equipment to hospitals all throughout the country about this years ago. I told each of those doctors that I would be willing to give my body to science so that I might have a full spine replacement. At my age and with my condition, even if it killed me, I would be in a better, less painful place. But if it succeeded, I could live a complete life again. I do the activities I gave up because of the worst agony every day. So, doctors, please, find a way to replace the whole spine. Then choose me. Story 23, there is something called the hard problem of consciousness. In general, we know a lot about how the brain works physically, how different things affect it, and how those effects lead to activities in the body. We also know a lot about psychology and sociology, as well as what it's like to be a human. We've had hundreds of years of philosophy and psychology, etc. The hard problem of consciousness asks how one thing might become another. How can we assert that a specific biological process in the brain generates this experience? Bees are a common example. We have some knowledge of how bee brains function, but we cannot comprehend what it is like to be a bee solely by examining the physiology of their brains. How do the brain's physical processes give rise to qualia, that is, subjective experience? Story 24, I'm not a doctor, I'm a medical researcher. One of the most interesting things we don't know is how memories are kept in the brain. We know that neurons connect and synapses get stronger, but we still don't know how a specific memory, like your first kiss or how to ride a bike gets encoded, stored, and recalled decades later. It's even stranger that we can edit memories while we're remembering them and putting them back together, but we don't really know how this works either. The brain stores petabytes of information in a space smaller than a melon and works on less electricity than a light bulb. We're still trying to figure out how it does this amazing thing. Story 25. We don't really know how most drugs function. If you listen to a pharmaceutical ad or go to a medication website, you'll see that they all start with medicine ABC is thought to work by. They can't say it works by, because we can only guess how they might work based on what substances and processes the body uses and what substances are in a medicine and how they might interact with each other. But right now, we can't see or prove that's what's really happening. We might know that a certain medicine raises certain neurotransmitters in your brain because we can measure those levels, but we don't know for sure why or how the medicine does it.